Now to health matters, where health professionals are calling on the incoming administration to take urgent steps in revamping the country's health sector in order to reduce the brain drain plaguing the sector for years. Health experts who gave the advice at a forum held in Ibadan, Oyo State capital, also emphasized that poor state of the healthcare infrastructure and working conditions in Nigeria has led to a mass exodus of healthcare professionals to other countries.
Nigeria has one of the highest emigration rates of highly skilled professionals in Africa, with an estimated 10,000 doctors and nurses leaving the country every year. This has led to a significant shortage of healthcare workers in Nigeria, with only one doctor for every 5,000 people compared to the WHO's recommended ratio of one doctor for every 600 people. It is against this background that the health professionals at this event want the next administration to increase funding for the health sector, invest in training and capacity building, as well as provide sustainable incentives for health workers.
So if you find out now what is dragging you outside, you can find it here. So it will balance and you will stay behind. I will pray that the incoming government will look into that, make sure the economy is stable, provide conducive environment for the health workers.
The stakeholders also made a case for a system that is designed to motivate and reward healthcare workers with exceptional performance and behavior towards healthcare development.
The recognition of the team for all the players, the key players in the healthcare space, it puts us, there's a pump it gives you when you know that all your hard labor, your effort, the time, the purpose that you give is recognized. So for the incoming administration, I think we have the right person.
The brain drain. The few hands that are left, we are overwhelmed. I shared jokingly there that sometimes 6 hours, you're on your feet, rendering care to the patients. Sometimes you even forget about your breakfast. I don't know about other hospitals, but in UCH, lazy medical personnel cannot work here. So I think that we should have more incentives from federal governments so that to motivate us to do more.
The event, which is the maiden edition of its kind, was organized to reward health professionals and stakeholders who have contributed immensely to the advancement of good healthcare delivery. Olaide Oyewole, TVC News, Ibadan.